Hello. Today I'm here to talk about the use of post-activation potentiation in untrained athletes and their ability to elicit the PAP response. As strength conditioning or sport performance coaches, our knowledge and ability to utilize all available methodologies and practices to influence our athletes' adaptation is one of the key roles we're going to play as coaches. Complex training is one of the tools that we can use, and this is one way that we can elicit the PAP response. Post-activation potentiation is created using a high load set followed by an explosive movement that's going to mimic that first set's motor pattern. The first movement is called the conditioning contraction, and the subsequent similar explosive movement is where we're expecting to see a PAP response. This is going to increase power output and neural drive to the muscles that are going to be active during the movement. It's often programmed as complex training and can be used successfully to facilitate increased adaptations for our athletes. Now, as we progress through this presentation, what we're going to see is that post-activation potentiation is most effective in highly trained anaerobic power athletes with a great density of type 2 fibers. There are other factors that we're going to notice that will influence our ability to elicit this PAP response. Gender, training status, and rest intervals are some of the bigger pieces of the puzzle. Now, PAP is considered a phenomenon that is believed to be caused by three possible elements. The first is a high load contraction that phosphorylates the myosin regulatory light chains. This causes greater sensitivity of calcium being released from the sarcoplasmic reticulum and allows the phosphorylated light chain to react to an increased rate for calcium being made available. Another likely reason that PAP is thought to work is changes in the resting condition around the alpha motor neurons that we're using in that conditioning contraction. A greater number of excitatory signals are going to be present, and we're going to have a decreased rate of inhibitory signals. Now we're going to look at a thing called the H reflex, which is caused by afferent feedback to that alpha motor neuron once we've previously activated our alpha motor neuron with that conditioning contraction. We'll also see the decreased inhibitory responses at the nervous system. Now, this cumulative effect of increasing excitatory responses, decreasing inhibitory responses, will also allow us to activate larger order motor units that causes an increased amount of power output due to the size principle and us activating those large order motor neurons. The last possible reason that we think PAP happens is because of a change in pronation angle once we've had that conditioning contraction. That shortened muscle is going to be more in line with that line of pull, having a decreased pronation angle and an overall larger cross-sectional area. Now we're going to look at a couple clinical trials and studies here, and what we see is Earline had examined three groups of subjects: highly trained Nordic and cross-country skier athletes and untrained males. Now, in both the highly trained Nordic and cross-country group, what we see are Olympic caliber or national caliber athletes. The subjects were tested on plantar flexion force, and they used supramaximal impulses of 1 millisecond in duration to try and elicit this really strong concentric contraction to help elicit a PAP response. Now, what we saw in the study is that the Nordic athletes eventually had the greatest rate of force development and twitch for post-activation potentiation, where the cross-country skiers and the untrained males did not elicit this PAP response. One of the reasons being was that the trained Nordic athletes were thought of having a higher density of type 2 fibers, as well as being trained for more of a power style athletic program. Now, Reardon examined experienced resistance trained men and the changes in pronation angle among those 11 experienced trained men. Now, they used three different types of protocols. They used a 75% 1RM for a moderate load, then a high 90% 1RM, and a 100% 1RM. And what they did is they looked at the changes in pronation angle, and they wanted to see if they saw a PAP response on the subsequent movements. Now, they did not demonstrate a PAP response during this clinical trial, but they did find a change in pronation angle, which is what kind of leads us into some of these more contradictory studies and some of the elements that make PAP kind of a difficult phenomenon for us to actually pinpoint and study. Now, TAPLI, when you looked at recreationally trained athletes, and this is where most of the studies lied, were within these recreationally trained athletes. Now, what they had was split into two groups, a complex and a conventional training intervention for 9 weeks. And what they noticed was no change in peak power, and with both groups they had similar changes and no significant differences between the groups. One of the reasons that they thought they did not see this peak power change, if you look at the picture on the right, is you're going to notice that there's this fatigue post-activation or potentiating relationship where we have a potentiated response, but the window is so small due to the fact that fatigue will be so high when we have this really high load conditioning contraction preload to try and elicit this PAP response. Now, Iglesias looked at the H reflex in regards to PAP in untrained subjects. Now, the results showed that in the 10-second MVIC, or maximum voluntary isometric contraction condition, that there was a small PAP response. They also looked at the condition of doing an MVIC for 7 seconds and did not see a PAP response. Now, they had discussed why this could possibly be, and the authors came to the conclusion that one could be differences in the fatigue response between the two groups of subjects, but also that in untrained subjects we see a high individuality in the response that we're going to get from this PAP elicitation. So with working with these untrained athletes, we might have a PAP response take place, but the window of fatigue might be very large. We might have a small performance increase due to the small window that the PAP response is greater than fatigue, or our untrained subjects just are not responding properly to this conditioning contraction. So based on available evidence, what we're seeing is that it's really difficult to have a post-activation potentiation response happen within untrained subjects. Again, highly individual on the response by those subjects. Now, using post-activation potentiation or complex training with untrained athletes based on evidence that we have found should be limited due to the potential increase for fatigue, and then we could actually hinder or make the rest of the workout we have for that day more difficult. We can also then delay the recovery response if the fatigue is higher than what we are intending it to be. Now, PAP and complex training is best utilized with our highly trained power athletes. And we know this, they have the greatest activation, recruitment, and the motor control and efficiency that we need to have this highly trained PAP response. Now, even with trained subjects, there is some difficulty. Now, I think this brings up one of the paramount issues of post-activation potentiation, is that no matter how much it's studied, there are conflicting results. There are different ideologies on rest time. There's a different window that is found between studies, anywhere from 4 to 20 minutes of rest and recovery time in between the conditioning contraction and the actual explosive movement. So using complex training can be a valuable tool with our higher trained athletes, but when we're talking about our untrained athletes, it's best to follow the regular order of exercise selection, going with power, then resistance strength, and working our way on down. Thank you for listening to this presentation, and I hope it was informative to you all.